When kids come for residential treatment, they have often been getting by emergency to emergency till they could get here, often on multiple medications for reasons that they're not indicated, in combinations that have not been studied, and it's too much. They can have side effects, they can have weight gain, they can feel foggy or over-medicated. And what we try to do is take a careful look at the medications. We try to simplify, if we're able to, shake the tree, if you will. We go through each of the medications one by one and really review them and see if they're still needed. And sometimes we are able to taper the ones that are not helpful and optimize medications that may be. We really try to take an evidence-based approach to using medications, and we definitely emphasize therapy to teach skills and to get at some of the underlying deeper issues that may be there fueling the symptoms. I want parents to feel that they will have a relationship with their psychiatrist, their child psychiatrist going forward, that they can ask questions, that they can ask what the evidence is for certain medications, either alone or in combination, what they should watch for, what they should be careful about, how long to use the medications. And so if they feel empowered to ask specific questions and to ask questions that will help their child's treatment, they feel much more competent and effective. They should be aware that most of the evidence we have in using medications for kids is for one medication at a time, sometimes two. When we get into what we call polypharmacy, or many medications at the same time, we're usually beyond what we have an evidence base to prove, and that we can use it safely and effectively. They also should be aware of what's reasonable to expect. Medications usually help a little, but they don't solve the problem. And so sometimes I think there can be expectations around medications that may not match what a medication can actually do. They usually help take the edge off, or they help a matter of degrees. But sometimes with particular disorders, the therapy is really a cornerstone of treatment. And we know that the combination of medications and therapy together almost always is more effective than either one of them by themselves. Families are out there doing their best, and they are trying to trust people who are also doing their best, but sometimes there can be that accumulation effect that happens. So it's a real nice opportunity when kids can come to residential treatment, and we have the luxury of a long period of time to observe the kids and get to make those medication changes one at a time. And so that's, we can get the most data that way. They're in a structured setting. Their sleep and their wake-up time are the same every day. Meal time is structured. All activities are therapeutic from morning till night, and so really there is no more ideal time to get a good sense of the medications, either the presence or the absence of the medications.